We're here shooting a commercial for the American Cancer Society. This campaign is really about the access to healthcare issue that's affecting everyone in this country now.
Ready, and action, Pat.
Access to care is going to be the major emphasis of our advertising efforts this year.
Ready, quiet please, roll sound.
I got the phone call, and I had gone through a biopsy, and they said, you have breast cancer, and you're in an absolute fog because you don't think it's going to happen to you.
Kathy lost her job. She was diagnosed with breast cancer, and she didn't have insurance, much like 47 million other Americans in the country now.
When so many people can't get adequate coverage, when so many people can't get access to physicians and treatment and early detection that they need, it's a huge problem.
The first time that I was diagnosed with cancer was actually in 1996. I was 15 years old. I was diagnosed with ovarian cancer. It can happen, no matter how old you are or your age, and it can happen more than once. Last year I was diagnosed with thyroid cancer.
It's like the most devastating, saddest, lonely feeling that you could ever go through.
With all the advances and all the great progress there's been in cancer, there's still a big gap, a gap that we need to help people understand is there.
Good, and cut.
This is a real person telling a real story, and she's done a wonderful job.
My coverage was the primary. Whatever they didn't pay, the secondary, I thought, was supposed to pick it up.
She's a classic underinsured story. Her husband had great insurance for her cancer to take the tumor out, but her insurance did not cover the ongoing treatments that she needed.
When I get the bills in the mail, an MRI was $5,000. Surgeries, treatments are thousands and thousands of dollars. And if you can't afford that, what do you do?
And cut, good.
On every medical bill that I have, they turn us into a collection agency. It's hard. They want money that basically you don't have.
I'm thrilled to be asked because, it's representing the American Cancer Society. I'm an example of what can happen to anybody. It was nice that I could call the American Cancer Society, and they said, here are the different places you can call, the different medical institutions. We want to get you in as soon as possible. Even though I know I'm going through this awful, terrible time in my life, there is some hope that I can get some help out there, and the American Cancer Society was absolutely wonderful.
I hope that this commercial causes people to take a step back and go, wow, this is a real problem, and I kind of need to do something about it.
It's a call to action, and we hope that they respond.
When people see this advertising, we're asking them to contact us, to get in touch with us, to look to us for three things: to learn more about the access issue, to speak up and be heard and tell their own story, and finally to get involved.